Hello friends, Sarah here from the Centre for Mental Health. I hope all is well. This video this week is going to be about the general election. Of course, if you're like me, you would rather we weren't having one completely, but of course we are. So let's make the best that we can in terms of conveying to our MPs and the government really what we think is important from a mental health perspective. So like any other time, the Centre for Mental Health has a mental health manifesto, and we have 12 big recommendations for government. And of course, you will have heard us talk about all of them over the last year especially. And so nothing that I'm about to say should be a huge surprise to you. But do have a look at the manifesto when it's published this week, because we do go into quite a bit of detail about why we have recommended the things that we have, and some stuff around the economics of those decisions. So I think I'm going to be referring to notes, so don't let that put you off, but I just don't want to forget all 12 of them, although, you know, Andy will probably tell me off if I do. So the first thing that we want to recommend is that the government absolutely commit to a cross-department focus on mental health. And what that really means is that mental health really isn't just a health issue. It's a life issue. And so we're really thinking about housing, welfare, we're talking about, you know, planning, defence, all of these things, actions on climate change. If all of these things had a mental health lens, we would probably see quite significant progress. And that's absolutely demonstrated time and time again through the evidence. So we make a call for that in a way that really is saying to the government that all of the other policies that you might have in place, including the NHS long-term plan, will not have the maximum benefit without this cross-government policy approach. So that's our single biggest request. We also want the government to continue to support the NHS long-term plan, and the £2.3 billion investment, we want to see that continued and grown. We also want to, I guess, see some transformation continue in terms of bringing primary and secondary care together. We want the focus on reducing health inequalities to be absolutely at the top of the agenda in all of these discussions and in all of these plans. But of course, we know that the NHS needs to ring-fence this money, and so we're very glad that that will continue, and certainly under a new government we expect it to. We obviously know that, and we've said it many times before, that the NHS is not a lone ranger. The NHS is not entirely responsible for the health and care of the nation. So we would really urge the government urgently to create a long-term sustainable investment plan for social care. We need to remind everyone that social care is not just for people in later life, although we know how important that is, but many people with mental health problems use social care you know, in their teens, and certainly in terms of adult working age. So we really need to kind of help the government understand the broad concept of social care, but equally the NHS can't do it alone. And so, again, we come back to a fair funding settlement for social care, not just for 1 year, but for the same lifetime cycle as the NHS do in the very least. We also know that children and young people's mental health is certainly struggling. And one of the things that we know affects children now and forever in terms of their lives is the school education system. We know that inflexible structures, exam stress, bullying, lack of resources, all of which contribute to negative and, you know, sometimes in the worst instance, very, very poor mental health. So from that perspective, we would really like to see a complete reform of the education system, with welfare really at the heart of the decision making, the plans around teaching and pastoral support. We've said many times that the criminal justice system must be reformed. We know that 9 out of 10 prisoners experience at least one mental health condition or addiction. We know that over half of those in probation also have mental health issues or addiction problems. So with that being said, we want to see the diversion from custody continue. Liaison diversion has had massive success in the UK. We want to see that amplified. We want to see a system whereby people get the services they need in the community. We also want to see trauma-informed environments in terms of the criminal justice system itself. We know that many people who find themselves within the criminal justice system have experienced lifetimes of neglect and trauma. We also urge the government to abandon the plan to build more prison places. The evidence doesn't support more prison places as the solution to the criminal justice problem. Indeed, we know that prison can often exacerbate the problem. We also know that investing in parenting could make a huge difference to the children who experience behavioural problems, to those children who have mental health or learning disability. Parenting programmes are a low-cost intervention, but have significant impact on children's lives. So we urge the government to reconsider the investment into parenting and to really focus on early years and helping parents make the right choices in terms of health and well-being for their children. We also want the government to re-engage and reinvest in public health. We know that people with long-term conditions, we know that children, young people, all of their kind of exacerbated experiences could be prevented by interventions at the earliest opportunity. We also know that not all suicides are inevitable, and that with proper local resourced suicide prevention plans, things could be very different for a lot of people who are currently not in contact with the mental health system. So we want to see the government up its game in relation to public health. We mustn't forget that by the time somebody gets to crisis, it can often be incredibly difficult to turn back the clock. We obviously want the government to continue with the commitment to reform the Mental Health Act. The review undertaken in 2018 really is extraordinary. The 154 recommendations will provide more autonomy for patients. It will create a reduction in the number of people who experience exclusion from an inequality perspective. It really pleased with the government to invest in the capital, in hospitals, to make sure that the environments can be trauma-informed and safe and comfortable for people in great distress. The Mental Health Act review really is an important piece of legislation, and we look forward to that being continued over the coming months. We need to develop a mental health workforce for the future. We need to provide training, we need to provide recruitment processes, we need to really think about peer support, we need to fund training, we need to provide bursaries for those people who struggle to access training opportunities. We really must think about social workers, occupational therapists, those who work in the third sector in voluntary organisations up and down the country providing services every day. We really need to get together and think about a vision of a workforce that retains their compassion, that can be innovative, person-centred, and can be sustained through periods of great demand. We're nowhere near that. We've got 27,000 people to find. So we urge the government to really throw their weight behind that process and all the work that's being done by our colleagues at NHS England, the Royal College of Nursing, the Royal College of Psychiatry, Health Education England, our peer support colleagues. We really need government support. So we also need to close the gap for those people with serious mental health problems and physical conditions. If you're someone with a serious mental illness, the risk of dying 15 to 20 years before everybody else is much higher. This is really an inequality that none of us should stand by and collude with. So as part of Equally Well, we are urging the government to really focus. They have already signed up to the World Health Organization's Sustainable Development Goals, and one of which is to reduce premature deaths by a third. We absolutely support that goal. We'd like to see it brought down further, but we need to start somewhere. But we need the investment into bringing physical and mental health together. We also urge the government, and these are the last two things that we are saying because we have a huge amount of evidence that supports this. For those families who've experienced baby loss, 5,000 families a year, we would like the government to invest what is a respectively small amount of money, 3.2 million pounds, to provide all of those families counselling and support at their greatest time of need. And lastly, we want people to be supported into employment with severe mental illness. We know it's possible. Individual placement support shows and tells us that. But alongside that, we also want the government to reform welfare. We want them to abandon the assessments that damage and disrupt people's lives. If you want people to go to work, if you want to support them with compassion and understanding and give them the best chance of sustaining themselves in work, then abandoning these punitive welfare assessments absolutely has to be a place to start. So that's a kind of rattle through our 12 asks of the government. I've probably got another 12,000 more, but we have to stop somewhere. We really want to know what you think. There are things that you might feel that we've excluded and should have put in there, and I'm sorry for that. We have identified these from the perspective of the things that we have the most amount of evidence for. That's really important for us in terms of distilling the things that we can talk about during this very tricky time. So let us know what you think. If you feel strongly that we've missed something out, please let us know. And yes, stay well during this very interesting time. Take care. Bye.